Hey, it's Brent. In the show notes for this episode, you will find several links with more information about some of the things I talk about during the first segment. I really encourage you to read those articles and to keep yourself informed. Coming up, Divided We Fail, the damage being done by counter-messaging, and good news about a Belizean artist turned crime-fighting superhero.
You're listening to Brent's Two Cents, the semi-serious thoughts of a guy in Belize. And now here's the host of this podcast from somewhere in Belize City, Brent Toombs.
From our vantage point, from the Ministry of Health, we are still asking that we have a single unified front versus SARS-CoV-2. I think it's rather unfortunate that we sometimes get singled out for everything that's not being done. I think we need to start to show that single unified front that we need in terms of being able to address SARS-CoV-2 successfully.
Hey, welcome to the podcast for the week of August 31st. Well, despite some optimism about the airport being scheduled to reopen on October 1st, the situation with COVID-19 continues to get worse in Belize. 94 new infections confirmed this past Saturday alone. That brings us to 964 total cases, with 836 of those being active. 13 Belizeans have now lost their lives to this disease. Almost certainly those numbers will have changed since I recorded this podcast on Sunday afternoon. That clip I played for you in the opening is Director of Health Services, Dr. Marvin Manzanero, during last Friday's press conference, expressing the need for Belizeans to present a unified front as we continue to battle the COVID-19 crisis. Now that's about as exasperated as I have ever heard Dr. Manzanero sound at any point during the past 6 months since he's been leading the medical and scientific efforts to control the spread of this epidemic in Belize. The man is utterly unflappable, and we owe Dr. Manzanero and his entire team a huge debt of gratitude. Hopefully, by this time next year, things will be back to normal, at least as far as the September celebrations are concerned. And if that's the case, Dr. Manzanero better be one of the people honored at the annual tribute to Belizean patriots. But unfortunately, not everyone appears to have as much confidence in the Director of Health Services as I do. And as the number of cases increase, and as more fatalities are recorded, the counter-messaging of whatever health officials tells us gets louder and louder. And that's potentially very dangerous while we're in the midst of an epidemic at a time when the best thing for Belize would be to present a united front. Fortunately, the anti-mask counter-messaging appears to have subsided, at least for now. I guess there's nothing quite like seeing cases rocket from 48 to nearly 1,000 in just a few weeks to encourage community buy-in for mandatory mask use. That's not to say we have 100% compliance, certainly not when it comes to wearing masks properly. But at least I'm not hearing as many bullshit claims about masks being harmful and that you could die from carbon dioxide poisoning by wearing one. But there are plenty of new talking points that the Facebook experts have seized upon to undermine the confidence in our national response to COVID-19. In the last few weeks, the Director of Health Services has been criticized for not testing enough people, even though by comparison, Belize is actually testing a higher percentage of our population than other countries in our region. Now, I understand the anxiety people have about not knowing their status. Every time my throat itches or I have a slight headache, I worry that somehow I've contracted the virus. And it would be great if I could get tested on request for my own peace of mind. But the system would collapse if every person who demanded a test was accommodated. That's why there's a systematic approach to determining who gets tested and why. And from what Dr. Manzanero has been trying to explain, that testing protocol changes as patterns of infection appear in various communities. And if you may have contracted COVID-19, confirmation of your condition will not affect your prognosis much. There is no magic pill that you will receive if you test positive. If you are lucky, as most people are, your symptoms will be mild and manageable. More severe cases may require hospitalization, perhaps even drastic measures, such as being placed on a ventilator. But when people suggest that there is some sort of agenda to intentionally not test people, it gives the impression that we should not trust health officials. And if the Director of Health Services and his team are not being honest about testing numbers, then maybe we should doubt everything they tell us, including how to prevent the spread of this virus and how to treat those who become ill. The latest so-called expert advice I've been seeing way too often lately in such reputable medical publications such as Belize Buy and Sell is that ventilators are killing people. These experts have concluded that because several patients who have required intubation have ultimately succumbed to their condition, that it must be the ventilator responsible for those deaths. These certified Facebook doctors are telling people that if their loved one reaches a point that intubation is required, that they should refuse that last chance course of therapy and instead demand something called oxygen therapy. But the problem with that is by the time a person needs a ventilator, it means their lungs are no longer functioning properly. And so unless a machine takes over the process of inhaling and exhaling, there is no way to get oxygen into the bloodstream, which will result in almost certain death. The harsh reality is that the chance of survival with a ventilator is not great either, but it's certainly better than without, no matter how many people on Facebook suggest otherwise. But the issue of greatest concern for me right now when it comes to counter messaging is the amount of people I see promoting untested and unproven medicines that they claim could cure critically ill patients, prevent further spread, and would end the global pandemic in just 6 weeks. If only Bill Gates and the WHO and the Illuminati and whoever else they believe controls this new world order would just let us take hydroxychloroquine or ivermectin. Now, I won't elaborate on hydroxychloroquine. That's been in the news for months thanks to a certain president who has been hawking it like a snake oil salesman at a county fair. But now, the most recent miracle cure to get traction in Belize is ivermectin, an anti-worm medication that is used for animals. One of the loudest advocates for ivermectin is Pastor Scott Sturm. And if it seems like I'm singling out Pastor Sturm, I am. Because while he may not be the only person in Belize peddling this quackery, he has a very large platform. Sturm has parlayed his control of the evangelical community and his involvement with a certain media house to elevate himself to a position of influence, and not just within the faith community. Sturm considers himself to be a leader on a national level in areas that far exceed issues of the church. This is a man who regularly demands meetings with the Prime Minister, and occasionally, the PM grants him that audience. So when Sturm goes on Facebook or Plus TV and says that ivermectin is the cure to COVID-19, and that he and his wife have been self-medicating with it, a lot of people take what he says as gospel. And now maybe you are smart enough not to believe a preacher with a history of playing fast and loose with the truth whenever it suits his agenda, but not everyone is. Or maybe the first time you hear about ivermectin, you hear it from someone you actually respect, who heard it from someone, who heard it from someone, and just like a lie that gets repeated often enough, eventually it begins to sound like the truth. Especially when it's backed up by professional-looking junk science stories that misrepresent statistics and omit facts. Sturm's biggest source of evidence that ivermectin can cure COVID-19 is what happened in Peru. In May, the Ministry of Health in Peru included ivermectin as an approved treatment for COVID-19 in official medical guidelines. That decision was based on the advice of one doctor who wrote a white paper after reading a study by a little-known US company called Surgisphere. Surgisphere, who is no stranger to scandal, made claims that their own in vitro and clinical trials showed that ivermectin could cure COVID-19. And for a few weeks, that report was widely circulated. However, it was quickly withdrawn after major scientific publications such as The Lancet and the New England Journal of Medicine discovered major flaws with Surgisphere's data. For example, the company included data from March 1st that claimed 3 patients on ventilators in Africa had been successfully treated with ivermectin. The only problem with that claim is that on March 1st, there were only 2 cases of COVID-19 on the entire African continent. An investigation by the Guardian newspaper in the United Kingdom found that most employees of Surgisphere, of which there are less than 20, have little or no scientific training. One executive is a science fiction writer, and another woman executive works as an adult model. The Pan American Health Organization has issued warnings against taking ivermectin, as did the Food and Drug Administration. Even the Peruvian National Health Insurance Organization is now advising its people not to take ivermectin. But this debunking came too late for Peru, where people flocked to purchase and administer ivermectin without medical supervision. When the supplies of the drugs intended for humans quickly depleted, they began using veterinarian ivermectin. And here's the part of the story that Sturm leaves out. It was evangelicals in that country that were pushing ivermectin on people in the Peruvian Amazon. In remote villages and provinces, evangelicals have been supplying ivermectin using local radio to encourage people to come for immunization and preaching that COVID-19 is linked to the devil and the end of the world, and that a shot of ivermectin was their only hope for salvation. And despite what the fake news and junk science websites try to tell you, there is no evidence that ivermectin has had any positive effect in Peru. Sure, nearly 400,000 Peruvians have recovered from COVID-19. But guess what? Neighboring Colombia has nearly the same number of cases, with a higher recovery rate and nearly 50% fewer deaths, without ivermectin. Or look at Chile, where if you extrapolate the number of cases to match Peru, Chile has a 60% lower mortality rate and a slightly higher recovery rate, again, without ivermectin. Don't you think if ivermectin was performing miracles in Peru, that this story would be covered by every major news outlet in the world? But then if you actually believe that the only reason that CNN or the New York Times or the Washington Post is not reporting about a cheap and easily available cure that could end the worst pandemic and economic crisis in over 100 years is because of some deep state conspiracy, well, then you probably stopped listening to this podcast several minutes ago. So let me bring this back to Belize and why Pastor Sturm spreading bogus medical information is such a problem. When you say that you and your wife have been taking ivermectin, you send a message to others to follow your lead, especially for those who already consider you a leader and an authority figure. And when you make claims that a cure is available, but that it's being withheld, you create doubt about the entire healthcare system. You undermine all the best practices and protocols that actual science and research have determined we should be following at this very critical moment. You are basically saying that you think Dr. Manzanero, despite all his education and training and experience and continuous consultation with other experts in the region and around the world, is full of shit. And that's not only dangerous for Belize, but it should be considered treasonous in light of the circumstances we are facing right now. So please, Pastor, and anyone inclined to counter-message what the actual experts are telling us, just stay in your rabbit hole if that makes you feel safe. The smart people have a pandemic to deal with, and what they need from us right now is a unified front.
We want to hear from you. You can find Brent's 2 Cents on Twitter and Facebook at 2 Cents Belize, or email us at podcast@oxaproductions.com. That's OXAProductions.com.
Hey, if I had advertisers, this is where I would take a moment to read some advertising copy, or what they call in the podcast biz, a mid-roll read. But I don't want to do ads. When I decided to produce my own podcast, the last thing I wanted to do was spend time telling you about my pillow or mail order underwear. But that doesn't mean I couldn't use a few bucks to help keep this podcast going. You see, even though I do this podcast for free, and you get to listen to it for free, there are still costs associated with podcasting, such as music licensing, internet hosting, and promotion. And those costs come straight out of my own pocket. And, well, they're starting to add up. But there's an easy way you can show support for this show, and that's simply by buying me a cup of coffee for just $3 or 6 Belize. There's a link for Buy Me a Coffee in the description of this show, and I'll occasionally post that link on Brent's 2 Cents Facebook page. So if you want to help out, just click that link and buy me a coffee. Thanks.
Forwarded to an automatic voice message system.
Hi, this is Brent. Thanks for calling the Your 2 Cents hotline. Please leave a message about anything you want to talk about after the beep.
Hey Brent, Simone here. Thank you so much for your podcast. Absolutely love the show. Now, I would like to talk about homeschooling and about the Ministry of Education. I think they're making it too hard for parents to homeschool because they demand that you have a college degree, at least an associate's. And I don't think that's fair. First of all, I think it's elitist because some families simply never had the money to send their children to college. But there's something called self-education. A lot of people are self-educated. They never got a piece of paper to prove it, but they've been learning all their lives. It doesn't matter if you've got that degree or not. What matters is that you want to help your child, that you're passionate about your child's education, and that you're willing to find the right resources. So yes, maybe test the parents, make sure they can read and write. But the most important thing that parents need is support. They need to be able to find resources. They need to know where to go if they have any issues, any problems. I home educated my children. They were homeschooled. They did very well. They've both ended up skipping grades in high school. I would not have been able to homeschool according to the guidelines, according to the rules and regulations today. And yet my children have done very, very well. And the reason why I didn't go to college was because I've been working since I was 18 and I've had a great career. So I really think that they need to rethink this. Parents need support. So for all the parents out there, you got this, you can do this. You've been teaching your children right from the moment they were born. You were the one who taught them how to speak, how to walk, how to tie their shoelaces. You got this, okay? And personally, I would love to help, but how can I even help? How can I even offer my services? I've got no college degree. So please, if anyone's listening from the Ministry of Education, please rethink this policy and help the parents out there. All right. Thank you so much, Brent. Bye-bye.
Now, before I wrap up the show, a bit of good news to tell you about. And chances are you already know this story, but I think it's good enough to repeat, and maybe some of the international listeners haven't heard this yet. Alex Sanker is one of Belize's top artists. He's an impressionist painter with a very unique style. Personally, he's one of my favorite local artists. Some days you'll find him in downtown Belize City working on his paintings while trying to make a few sidewalk sales. But last Tuesday, he was at home in his studio on Rayburn's Alley when he heard a commotion outside. At first, Alex said he thought it might be a fight, but when he went to check, what he saw was two guys beating and trying to rob a tamales vendor. Now, many of us might have hesitated to intervene out of fear for our own safety or fear of retaliation later. But not Alex. The artist grabbed a stick from a broken easel in his studio and ran to the defense of the victim, delivering several good whacks on the robbers before they fled, leaving their bikes and some other personal possessions behind. Reportedly, they did take $20 from the tamales guy, but more importantly, Alex saved him from serious harm or an even worse fate. And here's where the story gets even better. As soon as Alex Sanker chased off these two thugs and called the police, he began broadcasting the aftermath live on Facebook. The stream went viral as hundreds of people, including myself, watched Alex provide aid for the victim and give his report to the police. Fortunately, thanks to quick action from Alex and a rapid response from the police, the two alleged robbers, a 19-year-old and a 23-year-old, were apprehended. They appeared in court last Thursday and were denied bail. So now they're cooling their heels on remand at Her Majesty's Central Prison while they await trial. All thanks to artist and hero Alex Sanker. Now, Alex, if you're listening, I really hope you'll paint a self-portrait of yourself beating the wrath of those two thieves. And if you do, that painting should go directly to the National Collection of Belizean Art. Okay, it's that time of the show when I should be telling you about another Belizean podcast. But I can't find any more active Belizean podcasts other than the shows I've already told you about in previous episodes. But speaking of those podcasts, 2 Teaspoons of Belize and Belize Travelcast just released new episodes over the weekend. And Natasha Stewart dropped a new episode late last week. So be sure to give all those great Belizean podcasts a listen this week if you've not done so already. And that's going to do it for episode 9 of Brent's 2 Cents. Remember, you can find this show everywhere you get your podcasts, including Apple, Google Podcasts, Spotify, iHeartRadio, and all the podcast apps available for both Android and iPhone. Every episode is also uploaded to YouTube. Be sure to subscribe to this podcast so you never miss an episode. Once you subscribe, this podcast will automatically show up on your device every Monday morning, and you'll be able to listen to it anytime or anywhere you choose. And if you like the show, please don't forget to give it a 5-star rating and review, because that's what really helps an independent podcast like this get noticed. Remember, you can always contact me on Facebook, Twitter, or Instagram at 2 Cents Belize. And I especially encourage you to leave me a WhatsApp voice message that I can use on next week's podcast. You can find the WhatsApp number on the Brent's 2 Cents Facebook page. And finally, you can be part of the podcast movement in Belize by sharing this show with at least one person who otherwise may not know about it. There is no better advertising than your recommendation. So please help to grow the audience for Brent's 2 Cents and all of your favorite Belizean podcasts. Another way you can show some love is by buying me a cup of coffee for just $3 or 6 Belize. Hey, I may be doing this show for free, but that doesn't mean it's free for me to make it. So if you want to help keep this podcast going, just click on the Buy Me a Coffee link in the description for this show or on the Brent's 2 Cents Facebook page. Okay, I'll have another episode for you on Monday, September 7th, but until then, stay home as much as possible. Wash your hands, wear your mask, and most importantly, be nice to each other.
Brent's 2 Cents is a presentation of OSHA Productions, Belize's affordable professional video production company.